Welcome to the webinar, Strategies in Pursuit of Pre-K Teacher Compensation Parity, Lessons from 7 States and Cities. My name is Heidi Tomsky, and I serve as the chair for the Marin County Child Care Commission, which acts as the state-mandated local child care planning council for Marin County. I'm glad to be co-hosting this webinar with Dr. Zoee Bartholomew, chair of the Solano Local Child Care Planning Council, and to have with us as our guest speaker, McLean, Workforce Research Specialist at the Center for the Study of Child Care Employment at UC Berkeley. To give you a little bit of background on how this webinar came about, the webinar was designed as a strategy to address one of the needs identified in our Marin County Needs Assessment and that we included in our last 5-year master plan and our annual policy platform to champion equitable compensation levels for the workforce that are adequate, effective recruitment, development, and retention of professionals. We have a workforce crisis in our field, and one of the indicators is challenges we face in recruitment and retention of teachers. In order to systemically address this crisis, we need to be informed about effective policy tools and strategies. This is when we thought about connecting with the Center for the Study of Child Care Employment and inviting Caitlin to join us in a conversation about their latest report.
Hi, our webinar will last about 1 hour, and it will include a presentation of approximately 40 minutes by Caitlin, followed by some questions and answers. All participants, you will be muted, but at any point of the presentation, feel free to use the chat box below in your feature here. It should be in your right-hand corner to load up some questions. Depending on the number of questions, we may not be able to cover all of them during the webinar, but we hope this will be the first of the many dialogues we will have about these issues with Caitlin and other team members at the Center for the Study on Child Care Employment. So it's my pleasure to also be able to introduce Dr. Caitlin McLean. Caitlin's work at CSCCE focuses on the Early Childhood Workforce Index, which examines early childhood workforce policies and the economic status of the workforce across all 50 states and the District of Columbia in order to assess progress toward improving early childhood jobs. Her expertise in public policy and passion for the promotion of gender equality led Caitlin from Glasgow Caledonian University, where she was an Alyssa McKay postdoctoral fellow, to the CSCCE in 2015. Prior to joining the CSCCE team, Caitlin's research focused on comparative early child care and education policy, with a special emphasis on the US and UK, as well as additional research on ECE and other European countries. Caitlin holds a PhD in social policy from the University of Edinburgh, Scotland. Thanks for joining us for today. Here is Dr. Caitlin.
Good afternoon, everyone. Welcome. Thanks for having me here. I want to start us off looking at this picture here. This is a picture of an early educator in the United States. If she's lucky, she might teach 3- and 4-year-olds in a pre-K classroom, because by and large, such classrooms have better pay and better working environments compared to those of other early educators. And if she's really lucky, she might teach in one of the handful of states and communities which require that pre-K teachers are paid the same as elementary school teachers. But we know that such teachers make up only a small percentage of those who provide early care and education services for children aged birth to 5 in this country. Of the 1 million center-based teachers of young children, only about 6% work in schools. A further 21% work in community-based centers, which receive pre-K funding. But such teachers are less likely to be included in requirements that pre-K teachers be paid the same as elementary teachers. And so if our early care and education teacher is less lucky, and this is more likely considering where the bulk of early educators work, then she probably provides early care and education services in a private center or out of a home where her earnings are usually much lower. Even among those working in centers, Some early educators will be better off in terms of their finances, economic security, and well-being than others doing the same work. An early educator's wages will depend more on whether she works in certain settings or teaches older children than on her qualifications. She may have earned her bachelor's degree, but this is no guarantee that she will be paid a livable wage. As you can see here, the median wage for early educators with a bachelor's working in schools is about $20 per hour, which is still almost $5 less per hour than the median wage for kindergarten teachers. The median wage is $15 or less for all others in center-based settings. And for those of you used to thinking in annual salaries, $15 an hour is only about $31,000 per year. And keep in mind, that's with a bachelor's degree. The many early educators currently providing essential early education and care services in this country who don't have a bachelor's degree often earn even less. As a result of these low wages, teachers suffer financial stress and worry about affording essentials like food, which is something that we've documented at the local level and some of the studies that we've done at our research center. But in 2015, the Institute of Medicine and National Research Council put out a consensus report called Transforming the Workforce for Children Birth through Age 8, which lays out advances in our understanding of the neuroscience underlying what helps children learn and the importance of having skilled early educators to facilitate that learning. The report emphasized the need for access to foundational knowledge for all those working with young children birth to age 8, and a minimum of a bachelor's degree for lead teachers in particular. Crucially, as you can see in the quote shown, the report also makes the point that teachers' well-being matters. It matters for the teachers themselves, but it also matters for the children in their care. Poor working environments contribute to difficulties in both recruiting and retaining a skilled workforce. This makes things challenging for providers trying to fill positions, but poor working environments are also bad for kids and families, as high turnover has been linked to poorer child outcomes. Increasingly, we understand that early care and education is an essential service for a critical time in our lives. Yet for decades, there has been little to no progress in improving the working environments of those providing these critical services. Low wages for early educators aren't news. I'm sure many of you in the audience are familiar with this issue, and for those of you who are, have been, or work directly with ECE teachers, you may have firsthand experience with it. And yet, in spite of our knowledge, and in spite of folks at our research center and others bringing attention to this issue for decades, we've struggled to make advances. And one of the key reasons for this is lack of funding. Parents can't afford to pay the costs, and our public funding for ECE has historically been very limited. So it's not surprising that where we have seen the most progress in improving compensation and other supports for early educators is in publicly funded pre-kindergarten systems, which are more likely to fund most, if not the entire cost of services publicly, rather than relying on parents to pay directly, and are often provided for a wider group of parents and children, compared with, say, Head Start or childcare subsidies. This puts more revenue in the hands of providers, making it easier for them to pay their staff adequately. This is not to say that pre-K doesn't have its own share of problems. For one, it still tends to be underfunded compared to K-12. But having that stream of public funding and the state or local authority to govern its use means that there has been greater leeway in moving toward adequate compensation for pre-kindergarten teachers compared with other early educators. To better understand this movement and to inform stakeholders who are looking to take action on compensation, our research center, in partnership with NEAR, the folks who do the annual preschool yearbook, has released a 3-part series examining pre-K teacher compensation parity policies. That is, policies which aim to ensure equivalence in salaries and benefits between publicly funded pre-K teachers and teachers in K-3. The first resource is a short brief outlining a framework for understanding what parity is and what it isn't, which I'll explain shortly. The second resource is a longer report which tracks the status of policies across all the states using near yearbook data. And our third and most recent resource is what I'll be concentrating on today, where we looked in more detail at the policies of 5 states, Alabama, Georgia, New Jersey, Oregon, and West Virginia, and 2 cities, New York City and San Antonio, that have been moving toward parity for their pre-K teachers. And I'll just mention that in addition to the report, there are individual profiles which provide a full description of each state and city's current approach. Before I delve into findings from the report, I want to be extra clear about what we mean when we say pre-K. In this research series, we're specifically talking about publicly funded programs for 4 and sometimes 3-year-olds. They may be provided as mixed delivery, but we're not talking about all preschool teachers working with this age group, who may instead be working in Head Start classrooms or privately funded classrooms, in which case pre-K program policies would not apply. I also want to explain why we're focused on compensation parity between pre-K teachers, regardless of setting, and K-3. First, as mentioned in the National Academy of Medicine report, there has increasingly been a recognition that early education is just as important and requires similar training and skills to education for older children. That's why they recommended a bachelor's for lead teachers. If the expectations are the same, the reward should also be equivalent. Second, we know that if we want to recruit and retain skilled educators in early ed, they will need to be paid adequately, or they will leave. For example, to go to the public schools, which is one of the core rationales for these policies, as is clear from our report. Lastly, we focused on pre-K because that is where that has been the most movement so far, not because we think this is only relevant for pre-K teachers. In fact, education and compensation parity should be a wider goal for early educators more broadly. We know that early learning starts before age 4 and even age 3. And teachers working with those children should not face lower quality working environments, nor should younger children receive a lower quality service. But we are studying what has already begun to occur in pre-K, not what is yet to happen. So that being said, what do I mean by compensation parity? In our work, we have defined it as equivalent salary and benefits for equivalent levels of education and experience, adjusted to reflect any differences in hours of work, and including payment for non-child contact hours, such as paid time for planning. Notice a couple of key things here. First, the emphasis on equivalence in education. Parity policies have most often been pursued where pre-K teachers are already required to have equivalent qualifications to K-3 teachers, meaning a bachelor's and usually licensure. But there need not be a statewide qualifications mandate in order to implement a policy of compensation parity. Funding can be made available for salaries and benefits which vary by qualification level, such that pre-K teachers who do hold a BA, whether or not that's a requirement, could be paid equivalently to their K-3 counterparts. Further, there should be intentionality about what is appropriate compensation for qualification levels which are not equivalent to lead K-3 teachers in order to also fund those adequately. Similarly, there should be adequate reward for experience, with ongoing salary reflecting this. And K-3 teacher salary schedules can provide a model. Lastly, there should be attention to working hours. Salaries can't be equivalent if one teacher is working longer hours for the same pay, or if one teacher receives an hour of planning time while another does not, and is forced to do that same planning unpaid at home, which is currently often the case for early educators. So that's our definition of parity. But most places currently are not quite at that level of equivalence. And so we developed a framework to help us identify and talk about policies and strategies which move toward parity, but may not quite be there. Across the top, you can see the different components of compensation that we argue should be included, as I mentioned previously, starting an ongoing salary, benefits, and ensuring that payment includes equivalent time for professional responsibilities. Across the side on the left, there's parity at the top, and other types of compensation improvement which may be close, but aren't technically parity, going down the side. For simplicity, we distinguish between 4 types of compensation improvement: parity, partial parity, sub-parity, and other forms of compensation improvement. Each of the core components of compensation, salary, benefits, and payment for professional responsibilities, could, in practice, be set at any of these levels of compensation improvement: at parity, just below, or at some other level, which I will point out is most commonly less than parity with K-3 teachers, but it doesn't have to be. San Antonio Pre-K is forging a path forward with its own benchmark, which is not about parity with K-3, and is actually setting salaries at a higher level, which I'll come back to shortly. Now, it may seem like we're mincing hairs with this framework, but the purpose is really to call a spade a spade. So we want to make sure that when you're calling something parity, it's really parity. That way, when you're advocating for change, you can be clear if it isn't parity, so that one day you can reach full parity. If we apply this framework of compensation parity to current state policies for pre-K teachers, we find that on the one end of the spectrum are a few states with policies that meet the criteria for full compensation parity, meaning both starting and ongoing salaries are equivalent, and the policy includes benefits and payment for professional responsibilities. Most often, this is provided for lead pre-K teachers in public schools only, but in some places, they have been extending these policies to funded pre-K teachers in other settings. At the other end of the spectrum are any states that are not actively attempting to improve compensation, whether through explicit parity policies or otherwise. These states would not be able to locate themselves anywhere on this compensation improvement framework. In the middle, there are some states focused on compensation improvement, striving to narrow the gap between pre-K and K-3 teacher salaries by boosting some aspect of pre-K teacher compensation, but not quite at that level of parity, partial parity, or sub-parity. Other states have secured parity with respect to one or more component of compensation: salaries, benefits, or paid time for professional activities, but not for all 3. As before, these states sometimes limit their parity policies to particular groups: lead teachers but not assistant teachers, or school-based but not community-based settings. And where states have concentrated their efforts on only one component of compensation, it's usually salary. As mentioned, in our latest report, we looked at these 5 states and 2 cities to see how they've been moving along the path to parity. Not all of them are at the point that we would label full compensation parity, or even necessarily just full salary parity. But all of them have taken active steps in that direction, and we wanted to understand their rationale for doing so, as well as the challenges and opportunities they've seen along the way. Our intent was to show how action has been taken in a variety of contexts: state versus local, north versus south, local control or not. And we also deliberately looked at whether and to what extent these policies have been applied toward community-based pre-K teachers, as well as those in public schools. And so over the period between about December 2016 to May 2017, we interviewed pre-K administrators about their programs and their compensation policies. And I want to start with an overview of just some of the key findings before I delve into a few state and city examples. So first of all, there's no one model. We're finding that states and cities are doing what works in their context, and so they pursued different mechanisms. In some places, they've gone for state-level legislation. In others, it could be state leaders in local control states who are actively working with local leaders to affect change at the local level rather than trying to do a kind of statewide strategy. With New York City and San Antonio, we see cities moving ahead, even when state-level decision makers aren't actively pursuing this issue. We're also seeing that the road to parity is often incremental. For example, as I mentioned, starting with salaries. In other cases, they've worked to equalize working conditions so that salaries are truly equivalent. Or there's been an emphasis on raising funding to close the gap, even if it's not at full parity. And we've been hearing from administrators that they are seeing positive outcomes. It's still early days for most of these initiatives, so impact assessment has been limited. But in our interviews, administrators mentioned several benefits they've seen so far, such as increased interest of kindergarten teachers in pre-K, increased discussion about improving compensation for teachers not only inside but also outside pre-K, and in an earlier study of New Jersey center directors, they noted that directors had observed a reduction in turnover. But again, there has not yet been a systematic assessment of how compensation improvements in particular have affected teachers, their work practices, and child outcomes as well. Lastly, I want to quickly mention some key challenges. The main issue that administrators raised was implementing compensation parity for community-based providers, especially benefits. And in particular, there was concern about perpetuating or even increasing inequities within centers between funded pre-K teachers and teachers in different classrooms in the same setting. So that's a brief overview, but now I want to turn to some of our state and local examples, and I want to start with a statewide example from Alabama. Alabama has been a leader in pre-K quality for years, as measured by NEAR's annual preschool report. And attention to salaries has also been an explicit part of the program since its inception in 2001. Pay scales have been specified in classroom grant agreements, and there's been funding for incremental increases in pre-K teacher salaries since 2007, in recognition that teacher efficacy is the key to quality. More recently, though, there's been a push to bring pre-K teacher salaries more in line with K-3 teachers, which was spurred by a desire to retain trained pre-K teachers and concern that pay disparities between community-based centers and school settings was driving turnover and instability in community-based settings. And so pre-K administrators in Alabama decided to take an incremental approach toward compensation parity, beginning with a policy around starting salary. Initial budget calculations were performed to determine the cost of raising all pre-K teachers' starting salaries across settings to be in line with starting kindergarten teacher salaries. And then state administrators put in a request for an increase in the budget from the legislature, and were ultimately successful, not only in getting an increase for the original estimate, but also for an additional increase, as the legislature had also at that time approved a pay raise for K-12 teachers. Originally, their plan did not include a means to provide pre-K teachers with raises over time. But funds for step raises similar to the process for K-12 teachers have since been introduced. And going back to the framework we talked through earlier, a key aspect of Alabama policies is that they have included payment for professional responsibilities, which was explicitly set in line with what is provided to K-3 teachers. Specifically, all pre-K teachers are required to have an hour of daily planning time and are paid for 7 days of non-contact time per year. In Alabama, they are less explicit about benefits. Funds for benefits are included, but the benefit package provided depends on the individual grantee. State administrators expect these salary increases to have several benefits, including the retention and motivation of good teachers, increased professionalism, and more high-quality teachers attracted to early childhood jobs. And their intention is also to monitor effects over time in terms of teacher turnover and child outcomes. Alabama's case demonstrates the importance of linking pay to a broader push for high-quality services. Alabama is very proud of their score on the NEAR benchmarks, for example, and they have leveraged this and other forms of evidence to advocate for financial support of the program. San Antonio is an example of what we would call beyond parity, meaning their strategy was deliberately not pegged to the K-3 teacher salary schedule, but was set at what they considered appropriate for attracting the best of the best, in practice, substantially more than beginning K-3 teachers. So a little bit of context. In 2013, San Antonio created a model pre-K program funded and operated by the city, which also directly employs the staff in the program. The initiative began with 4 model pre-K centers strategically placed throughout San Antonio. And pre-K in these model programs is open to 4-year-olds for a full school day, plus before and after school care. And tuition is paid on a sliding scale based on parental income and is free for qualifying students. Funding for the program was approved via a 2012 ballot initiative that raised the local sales tax 1/8 of a cent. As a result, the teachers in the model program are city employees, and their compensation is governed by city policy, not district policy. Benefits are included, as well as paid time for professional responsibilities. Teachers participate in 3 weeks of paid professional development before school starts, as well as weekly group learning sessions during the school year, and receive about an hour for planning in the afternoons. Local administrators suggest that due to high starting salaries, more teachers have been interested in these pre-K jobs, resulting in an excellent applicant pool, including from elementary schools. Independent evaluations for the first 3 years of the program have shown positive results in child outcomes, and there's an intention to further investigate the specific link between higher teacher pay and the quality of the service, using data on teacher turnover and comparisons with school districts. San Antonio is an example of a case being on the high end of compensation policies for pre-K teachers. But that being said, their model is not to scale and only applies to a limited number of teachers, and therefore only a limited number of children and families benefit from having more adequately paid teachers. New York City provides an interesting contrast. They have a universal program for 4-year-olds and are now beginning to extend this to 3-year-olds, which means that their pre-K program policies impact a much wider proportion of their teachers and their children. But they've struggled to raise compensation for all of their pre-K teachers, including those in community-based settings, to a level equivalent to their K-3 teachers. In New York City, pre-K teachers in public schools are part of the city's teachers union and are paid according to the same salary scale. In contrast, pre-K teachers in community-based organizations are either unrepresented or are members of a union representing staff in child care centers. As a result, there remains a substantial salary gap between pre-K teachers in school districts and pre-K teachers in community-based organizations. And the city's current strategy has been working to narrow this gap, but they are not yet to the level of parity. Beginning in the first year of the rollout, funds were added to raise the starting salary for certified pre-K teachers in community-based settings. But a gap of about $6,000 annually remained, despite equivalent levels of education with those in public school settings. And in the second year of the program, an additional incentive program was established to aid recruitment and retention in community-based settings. Crucially, these funds are earmarked and cannot be used for other purposes. But again, they close the gap, but they do not reach parity. Our interviewees in New York City were aware that the current approach is not a complete solution. Their year 1 evaluation showed, for example, that staff recruitment and retention was more of a problem for community-based site leaders than for those in district schools, which again is not surprising given their lower salaries. That being said, one of the positive outcomes that they've seen so far is that efforts to raise salaries for pre-K teachers in community-based settings has aided the separate effort by the city's child care union to increase compensation for certified ECE teachers outside pre-K to the same salary level as that of certified pre-K teachers in community-based settings. So in New York City, change has been incremental, and they are not quite at parity, but there have been positive gains, which make a difference in the lives of providers. And if we look across the 7 cases that we examined in our report, we can identify some common themes. First is the role of data in making the case for better compensation. In general, the states and cities that we examined reiterated the importance of linking the issue of teacher compensation to ensuring that we have a high-quality ECE service by recruiting and retaining skilled educators. In particular, several states talked about the problem of turnover, how low earnings contribute to high turnover, which we know is bad for kids, but specifically having data on teacher retention rates and being able to show differences by earnings levels was helpful for those trying to make the case to fund salary increases. Related to this is the importance of having a strategy in place to document impact after reform. Data is needed to document positive impact on teacher well-being, retention, child outcomes, but also to consider other questions and assess any potential negative outcomes, such as inequities in access to higher paying jobs. And that's why data across the workforce, and not just for a particular program, is also important. Second, we know that pre-K parity policies are a step forward, but that they're not enough. As I noted in the beginning, pre-K teachers are a small portion of the broader early educator workforce, which means that many teachers will not see improved financial security and economic well-being simply as a result of pre-K compensation policies. And also that many children will not be benefiting from a more highly compensated and stable workforce. The most common challenges identified in our interviews, inequities within settings, lack of sufficient funding to attend to benefits, are very clearly a result of an ECE system segmented by age of child and funding stream, rather than a problem specifically caused by pre-K compensation parity policies. And so, as always, the issue of compensation comes back to broader policies about how we finance and deliver ECE as a whole. I want to end with a few questions for you to consider as you move forward in your own communities. 1, how do you see yourself applying the parity framework? Where are the gaps in your own communities, and where could you most plausibly take a step forward? 2, what data and information would help you in your efforts? Do you have information on educational levels and current salaries and benefits? And do you have information on turnover that can help you make your case? Lastly, what are some of the barriers that you'll likely face as you try to move forward on this issue, and how can those be addressed? Thank you all very much. It was a pleasure speaking to you. I've listed my contact information and more information about our research center in case you're interested in either this report or any of our other projects. And I look forward to your questions and your comments.
Thank you, Dr. Caitlin, for presenting this report. I think it is in alignment for sure with Solano County's initiatives, as far as we did try to acquire a measure on kids fund to be able to do some more funding in the areas of early childhood. I don't think we have anything specific related to the compensation parity, but I do talk to some of the providers directly, and funding is always an issue, and especially with compensation. So this is something that we can definitely take back to our team and be able to introduce this. Heidi, would you like to share a few words in Marin County?
Hi, yes, thank you, Zoe. We had a similar efforts here in Marin County last year. We tried to pass a local tax initiative called Strong Start, and unfortunately didn't pass by just a very narrow margin. So we're looking at redoing that in the upcoming year, which would be promising. We also do have one question for Caitlin from one of our participants. She's asking about who decides the parity or salary levels. Is that the same person? Would they need to be adjusted for cost of living?
It depends on
That's an interesting question. So who decides kind of depends on the context and sort of what's allowed. So for example, in Oregon, they passed legislation to say that for their pre-K programs, they are allowed, the state is allowed to set salaries. In other places, they didn't necessarily put that in legislation. It's just attached to the grant agreement. And then often what they've done is look to the K-3 system. And so they've said, okay, we're going to set the salary for anybody who has equivalent education to what it would be if you were a kindergarten teacher. And similarly, often those K-3 requirements or guidelines set out not just if you're starting, but also what the raise is annually, which often is a kind of cost of living increase, but also adjustments for experience, etc.
Thank you for answering that question. Another one that came up, Caitlin, is where do you think California is on compensation parity using the scale that you presented earlier?
Sure. So our understanding is that it's varied depending on where you're looking in California, because there is no kind of state level mandate that pre-K teachers be either equivalently educated or compensated to K-3 teachers. So I suspect that in a lot of places, at least if you're a pre-K teacher in the public school, then you might well be paid the same. But if you are a pre-K teacher in a community-based setting, probably you are not. It might depend on whatever requirements are set out at the local level.
Thank you, Caitlin. Any recommendations based on this report as far as where communities in California should begin?
Yes, so I think one of the challenges is actually being able to make the case that this is a problem and how you can fix it. And so what has been helpful in other places is to start with your own data on your community and being able to say this is what the gap is and this is what it would cost to raise salaries, and being able to point to why it's needed, making the case for it. And that was why I was talking about that link with high quality services, the challenge of turnover. If you have that data, it really helps to make the case for people and show that this is actually an issue right now that deserves attention and that deserves funding.
Yeah. Zoe, can you read the question?
Zoe, I think we have a question. Would you like to read it?
Sure. Let's see. All right, here's the question. Sorry, I didn't see it pop up. There is a question in regards to the research in San Antonio about the model. Do you know if they plan to continue the research and or extend to more cities given some of the success?
Well, if the question is about what they're doing in San Antonio, I know that they have been giving out funding to kind of give grants to other pre-K providers, but they're not necessarily expanding the model programs in San Antonio. And then in terms of our research, this is definitely kind of new area for us, and we're, in fact, is a new area across the nation, really, because a lot of these policies have been introduced relatively recently. But yeah, we definitely want to do more research on this subject. It's just a question of, when we'll get around to doing that. But I'll also mention that every other year, our center does an annual or a biennial index where we look across all the 50 states to kind of map where people are. And so we'll also be drawing attention to any changes in pre-K parity policies at the state level, although not necessarily at the local level.
So Dr. Kaylin, this is Dr. Zoe. I had a question of my own in regards to, were there any data collected around the fact that I know in Solano County, we're dealing with the issue of parents and families just even being able to afford childcare. And then of course, there's issues around the child subsidy and things like that. Is there any data to support how, it's very challenging for some of these providers just to have, enough income to even be able to support compensating these teachers? Is there any data around that?
I think this is a huge issue in the field that's been going on for a long time. And specifically to try to make that issue that we all know is a problem more visible, our research center has been doing some work in a couple of states to kind of cost out what it would require to deliver high quality ECE with teachers who are adequately compensated and have the proper supports. And the point is really to show what you're saying in a very concrete way, that this is how much it would cost. Clearly, parents cannot cover that cost, and they are not, which is why currently, even though parents are paying a lot for services, those actually doing the work often do not make very much because those two things just don't match up. The cost is really high, and parents can't pay it. So I'd say stay tuned because we are working on that, and we would have examples from 2 states that I think could help people really show this issue.
Thank you.
Hi, Caitlin. We have one more question from our group. As far as the data is concerned, who holds that data and how is it collected? As far as is there funding for that, or what's been a successful model in the other cities and states that you looked at in your research?
That's a great question. And unfortunately, we don't have a ton of detail on what they're doing with their data. That was kind of, for those of you who are familiar with doing interviews, it's one of those things that kind of bubbled up rather than being expected. So we know a little bit about what they're doing, but I couldn't say, for example, what exactly that data is. I suspect it's something that they're collecting as a result of their pre-K program kind of evaluation. And so I would think that they have money in there for that. But again, I don't have specific details across these states and cities.
Thank you very much for that very important information. I think we may be looking at closing for now, unless there's any other questions online. Zoe, do you have any questions online?
Currently, no. We only had the one question. Thank you.
Okay, very good. Well, these are all very interesting questions. So like I said, I think it's time to close our webinar. And of course, a big thank you to Dr. Caitlin McLean for joining us today as our guest speaker. I hope that you all found it very informative. The slides used today will be sent to you in a follow-up email together with a link to the video recording that you will be able to share with your networks. In this email, you will also find links to CSCCE, the Marin Child Care Commission, and the Solano Local Child Care Planning Council's websites. Thank you for your participation, and we hope you will join us in other webinars in the future. In this way, we'll be better informed and connected to advance and strengthen the early childhood education field in California. Thank you so very much.